Welcome, I'm Andy Garcia. The integration of science, technology, and medicine continues to reshape the way we look at health. Join us to discover some of the leaders in these fields who are changing modern medicine and creating an opportunity for a better future.
Multiple system atrophy, also known as MSA, is a rare neurodegenerative disorder that often shares symptoms with Parkinson's disease, but has a progression similar to ALS. A few of the symptoms include slow movement, stiff muscles, and slurred speech. There are anywhere between 10,000 to 50,000 people living with MSA in the U.S., and it's important for patients living with MSA to understand this disease and to find an advocacy group that will help you navigate the research and medical world of MSA.
Multiple system atrophy is a rare neurological disease. It is a mixture between Parkinson's and ALS. Clinically, a patient will look like they have Parkinson's disease and will actually initially be misdiagnosed with Parkinson's. And as the disease progresses, they'll be re-diagnosed with MSA. And MSA has a similar size patient population and progression as ALS.
MSA is a clinical diagnosis, which means it's based on the symptoms that a patient has and the findings that a clinician will discover on physical exam. So because this is a complex and rare diagnosis, usually patients are seen by multiple providers before they receive the diagnosis. Usually it's a neurologist that will make the diagnosis based on the history and the physical exam findings. The symptoms that patients with MSA usually experience are difficulties with movement and also difficulties with their autonomic nervous system. So there are two main subtypes. In one type, patients may present with symptoms similar to Parkinson's disease, such as rigidity, slowness in movement, and tremors. The other subtype is characterized more by problems with coordination and balance. In addition, patients will have symptoms of what we call autonomic dysfunction. So the autonomic nervous system is a part that controls a lot of the other functions of our body, such as blood pressure or digestion that we're not always aware of. So patients often experience difficulties in these areas as well. So unfortunately, there are no medications currently available that are specific for treating MSA, although there are several currently under investigation in clinical trials that we hope will be available in the near future. However, there are many medications to help with symptoms. For example, some of the medications that we use for Parkinson's disease may be helpful for some of the movement symptoms, or there's other medications available to help with symptoms of low blood pressure. It's also very important for patients to have a timely evaluation by a team of interdisciplinary specialists with experience treating MSA. For example, a movement disorders specialized neurologist, a physical therapist, speech-language pathologist, or others depending on the patient's individual needs.
Today's advances give us hope for a healthier tomorrow. Thank you for joining us. I'm Andy Garcia.